So the National Centre for Sport and Exercise Medicine represents the Department of Health's Olympic Legacy project, improving the nation's health through sport, exercise and physical activity. This was a £30 million capital project awarded by the Department of Health to 3 centres, one based in the north of England, Sheffield, one in London at UCLH and one here at Loughborough University in the East Midlands.
So the National Centre for Sport and Exercise Medicine in Sheffield is unique because it has a community-based delivery at its core. So the Panthera study is funded by Cancer Research UK. It's a novel trial looking at if we can use aerobic exercise training as a primary therapy for men with localised prostate cancer who have a low and intermediate risk tumours. Now for interventions like the one we're testing in our trial, i.e. exercise training, it would be interesting to see if we can take things out of what's called secondary care or hospital-based delivery for primary cancer treatments and see if we can actually move it into the community where it might be more cost-effective.
My research is on the effects of exercise on bone health and particularly with relevance to osteoporosis prevention. And one study that we've done, or one approach we've used, is looking at hopping exercises because that allows us to study what happens in an exercise leg and compare that to what happens in a control leg. So we've got the perfect built-in control inside the same person. And doing that, we've found, for instance, in older men, where we've looked not only at the bone density, but also using CT scans, which give us 3D pictures of bone, we were able to look at where the bone was changing. And we saw much greater variations in the bone thickness at some regions than others, which might have important implications for bone strength and for the ability of exercise to prevent hip fracture.
Our research involves alterations of lifestyles, which includes diets, activities and hormonal interventions across the lifespan. As part of that, we've developed 2 programs. One is called Cooking for Cognition, where we show particular foods which have been found to prevent dementia, which may improve cognitive function. And we also developed a program called Couch Potatoes for Cognition. These are resistance band exercises, which we previously found improved memory function significantly in people who were sedentary, so people who weren't used to exercise.
So our big study currently is looking at the oral health in Olympic athletes, and we've been actually delighted with the support of the various British Olympic teams, meaning that we've been able to carry out very careful, robust data collection and very accurate measurement of oral health, but also impacts on performance. Following on from that, we're also looking at mechanisms perhaps more closely, whether that's through nutritional aspects or inflammatory mechanisms. What could be very interesting with that research, as well as the impacts on performance, will be a closer understanding of how oral health affects broader elements of people's way of lives. And that clearly has some really potentially very important translational messages for the general population on how oral health affects people's quality of life and how we might work to enhance that.
So we do a lot of research on exercise and how it affects appetite regulation, with a particular focus on some of the different hormones that actually stimulate people to start eating or to stop eating. And we're interested in whether exercise can help better regulate our appetites. So we do a lot of work characterising these hormone responses to different types of exercise, different modes like swimming, running, weightlifting for example, and different durations and intensities of exercise. And we've done this work in healthy individuals who have a healthy body mass, and also more recently we're starting to look at people who are overweight to see whether their hormones respond to exercise in the same way as healthy people, or whether they may respond in a different way, which is more likely, for example, to make them overeat.
So the ethos is that There's been a disconnect between sport and exercise science and sport and exercise medicine in the UK, and this is really about trying to connect the two together. So all of the interesting research people have been doing on, say, elite athletes, can we translate that into the general public? Equally, some of the sport medicine work which has been going on with the general public, can we translate that to elite athletes? I think the National Centre for Sport and Exercise Medicine, the wider project across the whole of the UK, as well as the individual hubs, offers a unique opportunity to bring people together who wouldn't normally get together or would only get together on very rare occasions. And I think of, for example, perhaps the clinicians which support elite sport and an exercise physiologist researcher. They might bump into each other at meetings once or twice a year. What this gives us the opportunity to do is to bring all those stakeholders close together to be able to interact and work together. I think that it's difficult to predict what the opportunities will be, but I really strongly believe that being able to bring people together does enable us to generate those opportunities.